Hi guys, and welcome to the Empower Your Pelvis Clinic. I'm Morgan.
I'm Mina.
And we just really wanted to do this Zoom so that we could give you guys a little bit more of an idea of what really happens in a pelvic PT session. And this is something we get all the time from not only our patients, but other providers. So we'll go out and we'll market and we'll talk to personal trainers or other even physical therapists, doctors, and they're like, I'm not really sure what you guys do or really how you could help my patient or my client. And that's kind of what we want to do tonight. And we have to figure out ways to reach out without going into offices right now because of the pandemic. So welcome.
So we actually see lots of different patients in our clinic. Typically people think that we just treat just the female population. And that's, not really what we do. We see about 35% males in our clinic, not just old gentlemen that have had prostate surgery, but we could see anybody in their young 20s and 30s, 40s, really with pelvic pain as well, tailbone pain, low back pain, testicular pain, pain with orgasm, post-erection and orgasm.
Absolutely.
And with sitting, lifting techniques, and the list can go on and on with our males.
Yeah. And a lot of our people coming in will be like, well, I didn't have a baby. Why should I be here? And I would say a good amount of our patients are either pregnant or postpartum, but as you just heard, we have a good percentage of the male population, but we also see patients in their menopausal, years, postmenopausal, all of that kind of stuff that their pelvis needs to be looked at just the same as someone who just had a baby. So, like Amanda was saying, we're going over posture, lifting techniques, breathing techniques, how to use your abdomen. There's so many people that come in here who have great abdominal muscles, but they don't know how to use them correctly, and then how to then coordinate them with their pelvic floor. So we're trying to go either train them for the first time or retrain some of these habits that potentially have caused the symptoms for why they even had to come see us in the first place.
I think a lot of the population and even healthcare professionals think that we just do Kegels with our patients. And that's actually a very small percentage of what we do with our population. A lot of times the pelvic floor tends to be more high tone, meaning that there's gripping happening somewhere within this beautiful red tissue here, or the abdominal tissue. Maybe they're butt clenchers, back spasming could be happening, belly grippers. It's all over the place, but that can play into what's happening in the pelvic floor. So a lot of times, especially back when I started in the mid 2010, 2011, all we did was Kegels with our patients. And you soon learned okay, people may have a really small contraction, but it's because it's already here and they can't tighten up very well. So we've got to learn to down train, lengthen the tissue out. And that's actually a lot harder for our patients than actually learning how to pick it up and squeeze. So that down training is more of that eccentric control that we are teaching them, which is harder than the concentric, but getting them to move it through the full range of motion. Sometimes we need to do that unassisted. So that's like laying flat to check our pelvic floors. Sometimes we need the pelvis elevated so we can get some gravity assisted movement. We put them in lots of different positions here in the clinic to really check it, because we do not spend our day-to-day routine functionally, especially as mothers, laying down on our back or with our booty in the air. A lot of it is happening, standing up, bending over, lifting things, toddlers, laundry, groceries, car seats, diaper bags, or as we get older, more laundry because we've got multiple kids or we're moving furniture. We're doing so much functionally. And then we've got to think what's happening with the bowel and bladder too, because those are playing a huge role in that, or the uterus if we're dealing with any kind of prolapse or any scar tissue too.
Absolutely. And so like Amanda was saying, we have a gym here. We are out of our rooms all the time with our patients because we want to assess what they're doing during their day. Like she was saying, if we just have them lay on the plinth the whole time they're in here, we're not going to see the changes in their daily motions that are, again, causing them to come in the clinic. So we are really big into training them and going through lots of different exercise progressions and not just staying in the room. So that's why we love our clinic so much, is because we have so many patients that have come from other places and will say like, oh, it's just so nice. I feel like I'm not attached to a machine, or it's not just like I'm undressed the whole time. We're doing functional things because that's how what we believe is actually going to make a difference in their lives, or else why would they be coming in to see us?
So we do encourage, if patients do have their kids or their babies with them, we love to see that because that gives us a really good idea of what's going on. Or we're going to be asking their health history, how big are their children, how did they deliver, but we want to see weight wise, like how are they moving functionally while holding that in the gym. So we will have them walk around with weights. We may go outside, see how they're functionally moving with walking and running, how they're lifting objects. We use our sink and our laundry room here at the clinic to see how they're functioning that way as well.
Yeah. And so, and going on from there, we do other services other than just doing pelvic exams or doing any kind of classes. We do have online options as well, but we also are certified in dry needling, which has been such a game changer for a lot of our patients, because we will have patients come in with low back pain that's maybe causing them not to be able to pick up their kiddo, or maybe not get on the bike and they love to cycle. And even within one session, we see changes, which is just really cool in the world of physical therapy, because sometimes those changes can take a long time, and to see within session changes to speed up their progression has just been awesome. So we'll see patients really for orthopedic issues too. We have people come in here and they may not have any quote unquote pelvic health issues, but they are coming in for their neck, but it comes in, there's going to be some pelvic floor issue we're going to find, but their low back and their hips and their abdomen, which does play into the pelvic floor. So we are seeing people in a very orthopedic fashion as well. And so I think that's important for people to know when they're walking in here. It's not just all pelvic exams the whole time.
And with the dry needling, if you guys haven't heard of that before, they're little tiny needles, like acupuncture needles. About 15 of them can fit into a syringe that would give you like a vaccine. So very small. When we are putting those into our patients, we like to follow the nervous system, how the nerves are connecting with the muscles, and we want to reset those muscles that go with those nerves. So if the issue is in the pelvic floor, we like to tackle typically the L4, L5 region, maybe with the sacral roots as well. And then we're going to go to maybe glute med, glute min, glute max, hamstring, somebody that is correlating with this direct area that we're going into the multifidus in the lumbar spine or in the sacral area. And then if that's not the issue and the mom's got more upper trap region, tightness, neck issues, up mid back, we're going to tackle that as well. But what we see with our like pelvic pain patients, adding this in, or anybody with SI or sacral issues, sciatica, if we can do a dry needling session, we reassess after that. The pain, it's usually 50%, if not 90% better after that session, where they're walking out, they stand up. We looked at the functional movements that we looked at before we dry needled. They look incredible. And usually they're like, oh my gosh, I have no pain. Look at this. I can bend over and touch my toes, or my balance has improved dramatically. And that's what we really want to encourage with our patients. We let them know there may be some soreness over the next 48 hours, but to really stay hydrated. We do see patients in the clinic just for the dry needling. So if you are having patients that, you're just thinking it might need a little bit more speedier recovery, we can see them just for that and then give them back to you for whatever you're seeing them for as well.
Absolutely. So what even really is the pelvic floor? That's why I've been holding these the whole time. We want to give you guys a rundown really quickly of how we show our patients that come in the clinic that are a little like, I'm not really sure why I'm here. I don't even know what the diagnosis is that I got. I'm not sure what it means. All these questions that we are having to, all right, let's break this down. Let me show you what the pelvic floor is. Let's do an exam if you're comfortable with it. And so that we can get you started on some kind of program. But the pelvic floor is very busy. We'll start with that. So all the red that you see is your pelvic floor muscle tissue. We got some organs in here. But we have 3 layers of that muscle tissue, and you have a right and a left side, just like a right and a left leg. So we are assessing them when they are laying down in the pelvic floor and doing an internal exam gloved up to assess on both sides, each layer, are these muscles working like we want them to? Are they tight, weak, painful? Can they contract and relax like we want them to? If they can't, start going through those things that we're like, okay, this is what we're going to work on. This is what we're going to work on. I think this is such an important piece that is missing from a lot of patients' care, especially ones that have that history of chronic low back pain, or they've had issues with their cycles and periods forever. All of this, there's so much information you can get from these exams. But that first layer is really in charge of your sphincter control. Now, this is a female model. We do see men as well. So you're going to have to get a little creative, but these muscles through here are really in charge of cutting off any things that are coming out of our body that we really don't want them to come out, or they should open so they can allow things that we want to come in our body, come in. If we take this off, we have a second layer, and that starts to kind of come down. And this really starts to get that shows it better where Amanda has it. That starts to involve the tailbone a lot more. Tailbone pain is something we see a lot, and especially when it's cold out and people start slipping on the ice, we get a lot of tailbone pain because muscles are all around that bony surface, and they really make that tailbone have the movement that it has. That third layer is now in the base. Okay, so then we have our rectal opening. This is the vaginal opening, urethral openings. I know it's a little dark, but what I like to show in the third layer is you can kind of see how it fans up. And I think it's important to note this because that's where the rotation of our hips come into play, and not only in our glute muscles and some of the hip complex, but also in the pelvic floor. So we've had people come from other clinics that have done great rehab and just done more from an external basis. And then they come in here and they're like, I'm still having, issues with my single leg deadlifts. I have this pinching going on or whatever's going on, that we then assess their internal pelvic floor. And it's actually just that other side of the hip complex that's potentially causing that issue. So yeah, there's 28 of these muscles, 14 on each side, and they're so functional. They're not just for pee poop and sex. They're for posture and breathing, jumping, running. And that's why we do all of it in the clinic. So there's our pelvic floor.
So questions that maybe you would think, what can I be asking in my clinic? Things that we particularly ask and think that everyone should be asking is, are you having any leakage with coughing, sneezing, laughing, exercising, lifting, jumping, running? Okay, that should be number one. Are you having any leakage? Are you having any pressure with those same activities? Are you having any pelvic pain, tailbone pain, hip pain, low back pain? Those are typical questions that, providers are already asking, but I think we need to go into a little bit more depth in that. Ask if they've had children. Have they torn with any vaginal deliveries? Have they had cesareans? How did they feel after they had their babies? How soon did they get back into exercising afterwards? Did they deal with any symptoms in their first year postpartum? Because that can play a lot into maybe what they're feeling now. You can ask, are they having pain with sex? Sex is a daily activity or weekly activity that our patients are typically having. And that is something that, this is an exercise activity, what's happening down here with all these muscles. And we need to know, because of all that they do, that can be playing into what you're seeing them there for as well.
Absolutely. So we really feel passionate about screening your patients. I know when I was in a different setting and I wasn't really sure how to ask these questions, but sometimes you just have to rip the Band-Aid off, or if you'd feel more comfortable having a form so that they could at least check it off. The statistics are really crazy at how much people would lie to you face to face, but what they'll put on a form. So if you feel like your patients would be more comfortable, I just think even if it's so important to talk to, if you are seeing a patient and trying to help their health in general, these are things that need to be talked about.
And for our females too, asking when their last menstrual cycle was, what was the first start date, how regular are there, how long are their bleeds? That's very important for us females that we need to know. And I think as a male or female provider, we need to be asking that. And then for some of our male patients too, again, whatever clinic you're in, asking them if they're having their morning erections too, making sure that that's still happening consistently is a pretty good question, because that can tell us a lot as well.
Yeah. Well, thank you guys so much for joining us. We really just wanted to, again, tell you what really happens with what we do, because sometimes even our husbands are like, wait, what do you guys do?
You're allowed to say that?
Yeah, right. So I just think it's so great to be able to connect with other providers, and we love learning all the time and finding ways to continue to help our patients with different resources. And we just want to make sure that you guys know about us.
Thank you.